Okay, let's dive right into this explainer because it completely shatters a common historical myth right out of the gate. We're exploring the ancient hand-washing paradox, a wild story that takes us from the earliest human civilizations straight up to the modern hospital ward. And I promise you, what we uncover about human behavior today is going to change how you look at a simple bar of soap forever.
You've probably heard this question before, right? It's a great hook, and you see it everywhere when folks talk about history and hygiene. But here's the thing. There's a major flaw in the question itself. The premise contains a massive assumption that the historical record simply doesn't support.
The truth is, they actually did. Ancient humans washed their hands constantly. The Romans did it as this basically invisible social convention. But, and this is the kicker, they washed for reasons that had absolutely nothing to do with preventing germs. It created this truly fascinating situation where an enormous amount of genuine hygiene happened entirely by accident. They were doing the right thing for all the wrong reasons, while the actual biology keeping them safe remained completely invisible.
Section 1. Accidental Hygiene and Rituals.
So, before we had germ theory, the dominant framework for understanding disease was miasma theory. Basically, think bad air. The whole idea was that foul-smelling emanations from rotting material or sick people were what actually caused illness. Because bad smells equaled bad air, and bad air equaled disease, washing just made logical sense to them. They washed to remove bad smells, and by doing that, they were inadvertently fighting microscopic germs in the process. They got the mechanism completely wrong, but hey, the practice worked.
Because of this, the most consistent hand hygiene programs in human history were actually driven by spiritual readiness, not medicine. Across virtually every major religious tradition, ritual purity systems created extensive washing behaviors. You have the Jewish concept of tuma, requiring washing after touching a corpse or before eating. The Islamic concept of tahara codified ritual hand-washing, wudu, before prayer right into religious law. We see the exact same thing in Hindu ritual bathing and in strict Buddhist monastery codes. These folks were maintaining a state of ritual readiness but accidentally interrupting the fecal-oral route of major pathogens on a massive scale. It's kind of amazing when you think about it.
Section 2. The Invisible Science of Soap. Humans have actually been manufacturing soap for thousands of years, way before anyone understood the elegant chemistry behind it. We have clay tablets from the Babylonians back in 2800 BCE detailing a mix of water, alkali, and cassia oil. The Egyptians were using animal fat and plant ash, and by the medieval period, you had these super sophisticated commercial industries trading Castile soap from Spain and Aleppo soap from Syria.
The molecular mechanics here are just incredibly elegant. Basically, the fat-attracting tails of the soap molecules surround and attach themselves to the lipid envelope of a pathogen, like a virus or bacteria. Then, the water-attracting heads allow that entire complex to just get easily rinsed down the drain. This invisible process was genuinely reducing pathogen transmission, even when people just thought it was cleaning away visible dirt better than plain water. The science was working perfectly, even if the users were completely oblivious to it.
Section 3. The Doctor Who Was Ignored. Enter a Hungarian physician named Ignaz Semmelweis. It's the 1840s at the Vienna General Hospital, and he notices this terrifying disparity in childbed fever. In Ward 1, which was staffed by medical students coming straight from performing autopsies, the mortality rate was a staggering 10 to 15%. But in Ward 2, staffed by midwives, it was only about 2%. This disparity was so widely known and so deeply feared that women literally chose to give birth in the street rather than be admitted to Ward 1. So Semmelweis deduces that doctors are carrying what he called cadaverous particles on their unwashed hands. He decides to force his doctors to wash their hands with a chlorinated lime solution, and guess what happened? The mortality rate in Ward 1 plummeted. It dropped down to match the midwives at exactly 2%. He had irrefutably proven his theory with hard, unambiguous data. Now, this leads to an absolute tragedy of human psychology. You'd think the medical establishment celebrated the guy, right? No way, they didn't. His evidence was completely dismissed. Because there was no mechanistic theory, like the germ theory Louis Pasteur would develop decades later, to explain exactly why the hand-washing worked, doctors just found it too professionally uncomfortable to accept. Accepting it meant admitting they had been actively killing their own patients. Semmelweis was essentially driven out of the profession, eventually committed to a mental institution, and his life-saving protocols were completely abandoned until germ theory vindicated him long after his death.
Section 4. The Selective Success of Ancient Hygiene.
Okay, so ancient hygiene was highly effective, but selectively so.
Ritual hand washing brilliantly stopped those nasty gastrointestinal killers transmitted via the fecal-oral route. We're talking diseases like cholera, typhoid fever, and hepatitis A. But all the hand washing in the world was completely helpless against diseases that bypassed those routes entirely. The plague traveled via fleas, malaria via mosquitoes, smallpox through airborne droplets. So ancient people were getting the selective benefits of hand hygiene without really understanding the epidemiological boundaries of what they were actually doing.
Section 5. Infrastructure, the missing link.
The Romans built this incredible aqueduct infrastructure that made frequent washing feasible on a scale unmatched until the 19th century. But here's the catch. Because the causal chain of germs was invisible to them, their massive, warm, communal baths actually spread fungal and skin infections. They had the fresh water, they had the heating systems, but a shared warm pool is literally a perfect breeding ground for contact-transmitted pathogens. They were washing off the dirt, sure, while simultaneously transmitting diseases they couldn't even see.
And this poses a problem we still grapple with today. Right now, over 2 billion people worldwide currently lack access to basic hand-washing facilities with soap and water. 2 billion. When we talk about global health, we have to realize that for huge portions of the population, the barrier to hand-washing isn't a lack of scientific knowledge. It's not a lack of motivation. It is purely a lack of physical access and infrastructure.
Section 6. The modern hygiene paradox. But let's look at where we do have the infrastructure. Even in modern hospitals, where the stakes are quite literally life and death, and the science is perfectly understood, hand hygiene compliance often sits below 60%. Really think about that for a second. Soap and sanitizers are on every single wall, yet we still see this persistent, baffling non-compliance rate. It absolutely proves that just knowing the biological facts is completely insufficient to drive consistent human behavior.
Think back to the early days of the COVID-19 pandemic. We saw one of the most intensive public hand-washing campaigns in history, and self-reported behavior spiked dramatically. Everyone was washing their hands. But as the immediate motivational intensity of the crisis receded, that behavior quickly faded right back to baseline. So those ancient humans who didn't wash their hands for germ prevention weren't just missing a piece of scientific trivia. They were exactly like us. Our hygiene behaviors are overwhelmingly shaped by immediate social expectations, cultural rituals, and motivational contexts, rather than just abstract scientific facts.
I want to leave you with that provocative thought. We've solved the invisible mystery of germs. We've built the aqueducts and the modern plumbing. But if pure science and perfect infrastructure still can't make us consistently change our habits, what actually will? Thanks for joining me on this explainer. Keep questioning, keep learning, and maybe, just maybe, go wash your hands.